the UN has issued a warning about the potential for disease outbreaks in the flood-stricken Libyan city of Derna. The flash floods that occurred on September 10th caused significant damage and left over 30,000 residents in need of basic necessities such as clean water and food. The bursting of 2 river dams resulted in a tidal wave that destroyed residential areas and raised concerns about contaminated water and sanitation issues. Relief workers say there is a severe lack of medical supplies in areas affected by floods. Additionally, transportation is still difficult due to the damaged roads that have not been fully fixed.
There is a shortage of drugs, especially drugs for chronic diseases, such as hypertension and diabetes, and drugs for children. We also lack drugs for fever and inflammation. At first, most roads were cut off due to the flood, so it was difficult for relief supplies to reach the disaster-stricken areas. But now the situation has improved to a certain extent, and some sections have undergone simple maintenance. But we still need to rebuild some infrastructure to ensure that supplies can be better transported to the disaster-hit areas.
The International Rescue Committee is on the ground in Libya, providing relief efforts to victims of the flood that swept away entire neighborhoods in parts of the country. I spoke to Ciaran Donnelly, Senior Vice President for Crisis Response, Recovery and Development with the IRC, to find out more.
Libya was struck by a significant storm. Torrential downpours of rain led to significant flooding, including most devastatingly in the city of Derna, where two dams burst and a huge flood of water flowed into the city and washed away significant chunks of the neighborhood. So in Derna itself, there are thousands of people who've been confirmed as killed, thousands more who are missing, many of whom are also feared dead. Tens of thousands of people have been displaced and have lost their homes and livelihoods. Communities have been destroyed. There's also been destruction and devastation in other parts of Libya. The International Rescue Committee has 180 staff working in different parts of the country. We work in a town called Shahat, which is to the west of Derna. We have a health program operating there. Our staff there have been affected. Thankfully, our staff are safe, but many of their families have been affected. We've been responding and supporting the Ministry of Health in Shahat, but also we're able to send a team to assess the damage in Derna.
What are some of the issues that people are facing on the ground?
Yeah, so as you can imagine, it's a very chaotic and fast-moving situation on the ground. People are moving out of the affected areas, seeking safety, seeking refuge. The immediate priorities are medical assistance, making sure people are taken care of, treating the survivors. Many of the health facilities in those areas have themselves been damaged and destroyed, lost their stocks of pharmaceutical supplies, other equipment. So getting doctors and nurses into the area, we've been transporting Ministry of Health staff to affected areas, getting pharmaceutical supplies, medical equipment in, but also the basic relief items that people need. People need cooking utensils, blankets, they've lost everything. So first priority, help the survivors, help the living, help those who need immediate assistance. But there's a larger recovery effort that's going to be needed. As I said, in Derna in particular, in other areas, huge amounts of infrastructure have been destroyed, and there's going to need to be a reconstruction effort there. All of this is compounded by the reality that Libya has experienced over a decade of conflict and political instability. The country is currently essentially divided with two competing administrations governing the eastern and western parts of the country. And so social services, public services, maintenance of public infrastructure are all things that have suffered and have been in decline in recent years. So the starting point for many of these affected communities with quite a low baseline.
Given the current and possible future impact of the flood, how can issues such as waterborne diseases be prevented?
Yeah, I want to pick up on the public health threat from waterborne diseases in particular, and again in Derna where they suffered the worst devastation. We're really worried about the risk of, as you say, cholera and other diseases emerging. Not only has the water supply infrastructure itself been destroyed, but there's significant contamination from sewage systems that have been damaged, from waste facilities, from fuel from vehicles and petrol gas stations that have been damaged. So Water, to the extent that is available, is certainly not safe and puts people at risk, and that risk only grows over time. So the immediate need is in water tanking, new water facilities. Water purification is something that we're exploring with some partners as to how we might be able to, at scale, support Libyan authorities, Libyan communities to purify water at scale. When it comes to future developments, how do we protect against something like this happening again? Obviously, in this particular instance, the bulk of the devastation was occurred by the failure of 2 dams. So ensuring adequate maintenance to public infrastructure is critical, but so too is predicting the impacts of future extreme weather events. We know that with the climate crisis, extreme weather events, torrential downpours and floods are likely to be more frequent, and so infrastructure that was developed decades ago in many cases isn't fit for purpose, even when it is well maintained, which it often isn't in many countries, when it comes to the threats they're likely to face. So predicting or projecting forward, estimating as best we can the likelihood of extreme weather events and ensuring that construction standards in the reconstruction effort in Derna and elsewhere in Libya take that into account is going to be critical to protecting communities in the future.